and you have to be very fast. The faster you are, the more points you win. If you're slow, you lose points. The faster you are, the more points you win. If you're on screen, if your username is on screen, say aha, aha. I can't hear you. Aha, aha. If you are not on screen, say hey. I'm sure the young people are not the ones saying hey. All right, I'll give you 1 more minute. This is test. So I'll just use this to guide you and explain how Kahoot works, and then we'll go to the main one. So this just ginger us for the next session that is coming up. All right, are we ready to go? Are we ready to go? All right, so let's start with the first question. You see the question on screen, and then you see the answers in colors. And you choose the one that you think is the right answer, and then we go to the next one. Now let's start. In 3, 2, 1. Question number 1. This conference started on Monday, Tuesday, Saturday, or Sunday. This one you're attending. Now I tell you, you have to get the right answer correctly, and you have to be very fast. What's the correct answer? You're not sure? Saturday, Sunday? All right, let's see the correct answer. Saturday, and then let's see who are the people winning next. Black Lotus is number 1, followed by Linda, AY, Eric Jeans, Fa Yusuf. Let's go to the next question. This is just test. My questions are not going to be this simple, right? I'm just using this to test, right? Second question. True or false? Venue for this conference is Kigali City. True or false? Are we in Kigali? People are not sure. If anybody chooses false, I'll send you out of this room. If anybody chooses false, if you choose false, if you choose false. All right, let's see. Actually, some people chose false. You're not sure where you are. Okay. All right. I'll blame that on jet lag. It's okay. It's all right. All right. Let's go to the last question. This is just a test for you to get familiar with this. The full meaning of WHO is Wife Health Organization, Women Health Organization, World Husbands Kigali Limited, and the World Health Organization. If anybody choose Wife Health Organization, I have no comment. Actually, some people chose that. Interesting. All right, the right answer is World Health Organization. Let's see. Let's go. Let's see the winners for this. We have third position, Koala Bear. Who is Koala Bear? That's her there. A round of applause for her. Followed by Black Lotus, and the winner, unveiling the winner, Fa Yusuf. With Fa Yusuf. All right. This is just a test. Now we go to the real deal. Can you put on the screen the passcode for the real deal? Again, go back to kahoot.it, refresh your screen, go back to kahoot.it, kahoot.it, and then you're going to put in the passcode that comes on screen. I'll give a minute for the technical crew to put that on screen. If you're sure you're going to win this round, let me see your hands up. Very sure, very confident. Only about 5 people are confident they're going to win. Okay. I was going to announce the prize before, but because people are not confident, I'm not announcing any prize anymore. If you're sure you're going to win this round, let me see your hands up. Very sure, very confident. If you win, all expense paid, round-trip ticket to Ukraine. They're going to report from the front lines. Huh? Okay, we're waiting for you, technical crew. Are we ready? we have any difficulties? Let's do this very quickly. Supposed to see passcode. Okay, I think it's coming up. All right. Go to www.kahoot.it. No, wait, hold on, don't start yet. And then put in the passcode 3229400. Some people are so fast. I've not even finished speaking there on screen. I'm going to wait about 1 minute. Oh my God, names are just popping up everywhere. I see people want to go to Ukraine. I'm joking, not tickets to Ukraine. Don't go my hold me after this for your tickets to Ukraine. I see Qatar on the screen, although they didn't win any match at the World Cup. If you're on screen, say aha, aha. If we should wait for you, say yay. I can only hear baritone yay. So wait 5 more seconds and then we start. 5, 4, 3, people are lobbying for more seconds. 2, 1. Are you in? We're waiting for one more person. Are you in? 2. All right, excellent. Now let's start. We're going through 10 questions, fastest finger first. Know the answers and be very fast. And now we're about to start. Go ahead. See the first question. This is a Kahoot about the conference. 3, 2, 1. Let's see the first question. The full meaning of CPHIA is Conference on Public Health of Africa, Conference for Public Health of Africa, Conference on Public Health of Africa for Africa and by Africans, Conference on Public Health in Africa. The answer is on the screen. If you don't know the answer, it's here. Because some of you are now doing mathematical calculations. And some people got the answer wrong. All of you that chose Conference on Public Health of Africa, clap for yourself. All right, let's see who is leading. We have Stephen leading, Unicorn 225, Linda 1, Hortensia, and G. Okay? There are 9 more questions to go, so you have the opportunity to get on the leaderboard. Let's go to question number 2. Who is the youngest president in Africa? Let's see if you know your continent. President Buhari, President Abiy Ahmed, President George Weah, or President Paul Kagame? Youngest president in Africa. You have 6 more seconds to go. 5. Some of you are trying Google. It's too late. Too late. President Abiy Ahmed Ali. All right. Somebody named the winner is currently winning. Who is winner? Who is winner? Winner is currently winning. Let's see whether we stay on top. Let's go to question 3. Which country has the oldest pyramid in Africa? This is a trick question. Oldest pyramid in Africa: Rwanda, Egypt, Morocco, Sudan. This is a trick question. Oldest pyramid in Africa. It's a trick question. Answer will be revealed in 5 seconds. Oldest pyramid in Africa. This is a trick question. If you chose Egypt, you are very wrong. I warned you. It's a trick question. Let's see the answer. Let's see the leaderboard. Winner is still winning. A round of applause for winner. Is still winning. Croatia won, and Croatia is winning. Let's see the team of the Youth Pre-Conference of CPHIA 2022. It's on the screen. Meaningful youth engagement for advancing sustainable health security in Africa. Some people's answers are very fast. You will not wait for the brain to communicate the answer. You just pick one. Let's go. Winner is no longer winning. We now have winner has been displaced from number 1. We now have Philos 250, Rotangwa. Winner is number 3. Croatia is winning at number 4. And Biko is number 5. Some people have not even appeared on this leaderboard. What are you doing? After drinking coffee and eating cake, you pay for the coffee if you don't show here. All right, let's go to the next question. Which of the cities is not in Africa? You have Praia, Mombasa, Ibadan, and Bonn. Which of these cities is not in Africa? Which of these cities is not in Africa? Ibadan, Mombasa, Praia, or Bonn? All the cities are not in Africa because some of you are very confused right now. The right answer is Bonn. Praia is the capital of which country? How many people know? Cape Verde, right? So please know your continent. Let's see the leaderboard. Winner is back on top. A round of applause for winner again. Winner Croatia back on top. Biko, Philos, 250, Rotangwa. And let's go to my next question. The smallest lake in Africa is between DRC and Uganda, Liberia and Los Angeles, Tanzania and Nairobi, Nigeria and Cameroon. Don't worry, if you don't know the answer, just pick one. But please don't pick Liberia and Los Angeles, huh? The right answer is between DRC and Uganda. Let's go ahead. Winner is back. Biko is now leading. Croatia 1 is number 5. Queen B is now number 3. Let's go to the next question. How many more questions do I have left? I think I have about 4 questions left. What is the largest city in Africa? Lagos, Accra, Cairo, or Luanda? Lagos, Accra. Hey, in this quiz, I'm a dictator. There's no democracy here. All right, next question. Let's see the leaderboard. Queen B is leading. Croatia 1 is number 2. Where did winner disappear to? Answer me is number 3. Biko is number 4. Philos 250 is number 5. Some people, if you check now, they are number 97 on this leaderboard. Okay, let's go to question number 8. What is the smallest country in Africa by population? Now, the lawyers are happy with this question. It asks all the facts. Seychelles, Namibia, Guinea-Bissau, and St. Helena. If you choose St. Helena, you are very correct. Don't listen to what I'm saying, please. Even me, I don't know how this was done, but let's go ahead. Let's go to the next question. I think there's something wrong with that last question. Yeah, Ebola virus. Yeah, it's sold by Merck of Rahway, New Jersey. True or false? True or false? There's something wrong with my last two questions. Apologies about that. Let's go to the last two questions. The number of young people invited for this meeting it was announced this morning by the moderator. In 3, 2, 1, and 0, let's see the answer. About 200 was announced by Ibrahim. 3,200 young people applied. About 200 young people were selected. Let's go to the final question. Which African country qualified for the quarterfinal of the 2022 World Cup? That's my country, right? The country that qualified belongs to all of us. It's our adopted country. And we hope they win today. Is it today or tomorrow? And the answer is Morocco. All right, so let's see who is winning this quiz today. Third position is Queen B. A round of applause for Queen B. Second position is Assel. And the first position is Oti. Where's Oti? Woo! And where's Queen B? Queen B? That's Queen B. Round of applause for her. And where's Ansel? Where's Ansel? Ansel? If your table did not win anything, a round of applause for yourselves.
All right, let's put our hands together for Rotimi. Thank you very much, Rotimi. So this is the first of the games we'll play to break the monotony of the sessions. I hope you enjoyed it, but I also hope you learned one or two things. Yeah, winner, I sympathize with you. Yeah, there will be other sessions. I was rooting for you. I was like, winner, win, win, win. All right, so we will go to the next session now, and we will be looking at issues about technology and innovation. It will be a 10-minute input from our colleague, Enagagement, who is from the Ministry of Health in Ghana and works on issues relating to the national e-health implementation. Shall we put our hands together as I invite to the podium Enagagement for his input. Please keep clapping until he gets to the stage. Louder, louder, louder.
Hi, thank you. I'm Enagagement from Ghana. I'm a student and also a worker. I am here to tell you about my story that sometimes it makes me a little emotional, and one that is going to give you hope. And also it's connected to the earlier conversation that do not settle for little. In 2017, government of Ghana started a rollout. The government intended to convert all health facilities in the country from paper-based record to electronic, such that a patient who visits one facility to the other, they can share the patient's information. But in 2017, after the rollout in 21 facilities, about 12 of them stopped using the system. And I started asking myself so many questions. Why do we have this? To improve on the health sector, especially public health, and hospitals have stopped using these systems. So I wrote a letter to a funding agency, that is GMPC in Ghana, that I have identified a challenge that I would want to work on for a PhD. And the agency bought into the idea that based on the issues, they were going to sponsor me for the entire PhD program. After investigating the issues, I presented to the Ministry of Health the challenges with the implementation and why most of the hospitals across the country stopped using the system. And upon further engagement, the minister straightforward appointed me to lead the whole implementation across the country as a student. So you do not give hope as young people. If we are talking about the new public health order, it has already started. And young people would have to strive and have place. When I was given the role to lead the implementation, right now we've converted all the teaching hospitals, regional hospitals, and district hospitals, and we've registered 9 million patients who are receiving care through the system across the country. This is my story, and I am here to share this story with you, just to give you hope. Don't relent. Don't give up. You do not know who is watching whatever you are doing. There are areas in digital implementation. For instance, if we pick electronic health record systems, it has voluminous data for data mining, telehealth consultation. There are people in deprived areas who do not have access to quality health care. Through video call and conferencing, we can extend services through video calls to outreach patients. And even just mobile applications can help us connect to medical doctors far to reach and share personal information and conversation with them just to enhance on our health. So this is the story I want to share with you today. Thank you.
Profound. And I'm glad that you shared your story with us, because one of the things we wanted to point out with these 10-minute sessions is to also show you how many young people are engaging in their own environment. So if you look at your agenda, it's not just those who are working at the continental level, it's also individuals like Edward who work at the national level, and we will also have sessions with many of our colleagues who work at the community health level as well. So look forward to these sessions, use them as an opportunity to inspire yourself, and also use them as an opportunity to also speak up about the things that you do. When we were reviewing, and we did, the 3,700 applications that we got, there were so many brilliant people. So many. But you must have an extra edge over others. Countries like Nigeria, Kenya, Malawi, Cameroon had in excess of 500 applications. We can't bring 500 Nigerians, we can't bring 500 Malawians, we can't bring 500 Cameroonians. But it doesn't mean that the 500 people were bad. They were very good. But if you do not package what you do very well, if you cannot speak concretely, articulately about what you do, you will miss opportunities. It's not just for conferences. For many of you who are researchers, this is what happens to your proposals. For many of you who are looking for new jobs, this is what happens to your CVs. And imagine that these are done by humans also. So if they open your CV, and I'm sharing this, there were people whose CVs were commented on by someone, and the comments were still there when they submitted. No, there were several things that we saw. Some people submitted it for another thing, and so the CV still had applying for something else. Attention to details, all of these things matter. We are all professionals. We are good at what we do. You know, you're one of the smartest technicians or smartest health professional, whatever it is that you do. But you see, all those little things are why you question, so we're sharing this with ourselves so that as you also leave this conference, you just don't build your capacity on technical things. It's also on life skills and things that help you get ahead in life. And I hope you take that lesson as we also share it with you. So thank you very much. At this point, I would like to invite to the stage for the next session, Mr. Shola Fagorusi, Researcher and Executive Director of One Life Initiative for Human Development, who is our lead researcher for the background paper. So let's put our hands together for Mr. Shola Fagorusi. From your CVs, we selected 2 discussants. We didn't know them from anywhere. We basically just looked at their CVs and said, well, let's put them on the panel to discuss the paper. So may I invite Ms. Reem El Sayed, Technical Officer from the Egypt Healthcare Agency. Ms. Reem El Sayed, you're welcome. Please let's put our hands together as she makes her way. One more time. Last but not the least is Dr. Abdushakur Ali Mohammed, Team Leader of the Danish Refugees Council Project, the health unit in Somalia. So please let's put our hands together for Dr. Ali Mohammed. And our moderator for this session is the inimitable Kadebe Makanete, the M&E officer at the Africa CDC.
Thank you very much, Mr. Ibrahima, and good afternoon, everyone. Good afternoon, Dr. Abdishakur, thank you, Reem, and Shola. Thank you. Without further ado, let me invite you to present the paper, the background paper on youth engagement in public health in Africa. Thank you.
Good afternoon, everyone. Good afternoon, everyone. Okay, I'll put this, this will go up now. I'll just be running through a presentation titled Youth Engagement and Public Participation in Public Health in Africa. And the interest here is to look at what are the evidences available, what exactly is happening on the continent when we talk about young people and public health. Again, I'll start by re-emphasizing that Africa's youthful demography provides for us a very real opportunity for the continent's development. And what this means is that if we say that the median age for the continent is about 19.7, it means that truly we have a population that we can actually harness for our own growth and development. But again, it should equally be worrisome for institutions and groups with clairvoyance that if we actually have 70% of sub-Saharan Africans under the age of 30, then depending on who is actually having this conversation, it could either be a blessing or a cause for major concern as well. Aside from this, again, the continent also bears the burden of actually managing quite a number of outbreaks, whether it's communicable or whether it's a non-communicable disease as well. The new public health order by the African CDC, calling for the African Union Head of State and Government for a full implementation in terms of global health security, is also a reflection of the fact that this is becoming a concern on the continent. While the reality of the youth population actually persists, the continent continues to actually bear the burden as well, and which means that if we actually ignore this, several of the economic milestones that we're looking at actually achieving on the continent will become something lost to us. Again, if we could look back and look at what the data is showing us in terms of information, in 2015, we had about 1.6 million Africans actually dying from malaria, tuberculosis, and HIV opportunistic infections. In 2021, we had about 600,000 malaria deaths recorded in sub-Saharan Africa as well. We still have 2/3 of the population of persons infected with HIV on the continent too. Again, when COVID-19 actually happened, the several predictions we had was that Africa was going to be worst hit by this, but that didn't become the case. In fact, Africa became the continent with the least number of COVID-19 infections and deaths. We had 6.6, given data up until yesterday, we had about 6.6 million cases. We had about 6.6 million cases of death recorded globally, and for Africa, we had a low rate, which was about 174 cases of deaths. By February 14, 2020, Africa had its own first case of COVID-19, and again, it showed that despite the fact that the concern became what were the health infrastructure we actually had in place, Africa somehow was able to manage through, and we're still managing through that as well. But now that we are beginning to have some of those health structures in place, it means that there's an opportunity for us to actually sustain this. There are several dimensions to the population of public health, which has been talked about today. The fact that we're even talking about being alive. But again, it takes us back to that basic definition of health, which is about, talking about the complete, state of well-being. And we're not just looking at physical state, we're also talking about social state, and we're also talking about the mental state as well. But the scope of public health itself is where the interest is. When we talk about public, policy development, when we talk about collecting and disseminating evidence for health policies, when we talk about the various actions taken as well in terms of interventions and the various strategies that go with them, when we talk about the prevention and control of diseases as well, and the various intersectoral action for better health. And lastly, again, talking about the human resource development and capacity building, it gives us a very good sense of this. So what exactly is the problem statement here? What exactly are we trying to look at? We're saying that within the purview of public policy development, there's a public health approach to youth development and to youth participation. The current post-pandemic era offers an appropriate time to reflect on the threats, if there are any, and then to look at the opportunities that comes with the participation of a very key demography, within this, within our population, and we're talking about young people in this area. I've tried to look at this in terms of, a conceptual framework, and I've tried to look at this from the context of the social cognitive theory developed by Albert Bandura, which has its origin from the social learning theory. And the idea behind this is that only within a social context that bears with its ongoing interaction between the environment, the behavior, and the person, that's only when learning can actually take place. And the overriding interest here, looking at COVID-19 pandemic, for example, quite a number of behaviors were supposed to be learned. Quite a number of behaviors were also supposed to be sustained. We're talking about social distancing. We're talking about sneezing into our elbows. We're talking about washing our hands. Quite a number of them as well. And there's a reciprocal determinism as well, which talks about that at a certain level of the social environment, and also talks about it at a certain level of the individual as well. So then, how is the landscape of public health actually changing on the continent because of the engagement of young people? What are those reciprocity that we are actually seeing in terms of how the environment is actually affecting how young people are responding based on the challenges in the environment, and how young people themselves are also responding, either based on career aspiration or based on new learning as well. So that's what the socio-cognitive theory basically helps us to look at. I've tried to identify quite a number of emerging trends, and this is where I want the conversation to actually lean on, to help us see what are those things happening within the African society that we can actually look at. There's a massive play of technology at the moment. Edward just spoke about how he has leveraged technology to actually expand the space of public health delivery within his own country. In terms of the teams of various international non-profit organizations, which is talking about the donor space now, we have issues around youth health and healthy lifestyles. There are interests about youth and technology. There are interests around youth and climate change. There are interests around youth employability. There are interests around livelihood issues and youth development as well. And the deployment of various approaches as well is also a new trend. We're beginning to see approaches that are peer-to-peer. We're beginning to see approaches that are not just peer-to-peer, but are also near-peer mechanisms as well. For the public health space as well, one of the trends is also that there's a very low entry requirement into the public health space. You don't have to have, be a medical doctor. You don't have to be a nursing graduate. You don't have to have certain qualifications like you would actually expect in other careers. SRHR, which is sexual and reproductive health and rights, and adolescent sexual and reproductive health and rights is also becoming a major priority as well. So every time several people talk about public health, what first comes to mind is that you're having conversations about SRHR or ASRHR. Aside from these as well, there's also issues around electronic storage of big data to say that, look, the massive data we actually have in terms of healthcare, in terms of age, in terms of number of persons, number of patients, the type of illness being actually attended to. How are these data managed to actually show patterns and trends? It's also becoming a major trend as well. So individuals, youth are actually using this to actually make some inroads as well. So we have dashboard like the one we actually have on the Africa CDC website as well. There's also a climb in terms of public health as a first degree program. Up until a decade or two back, what we actually had in terms of degree program for public health was usually at the postgraduate level, master's or a PhD program or a PGD program as well. There are also now quite a number of youth-led organizations that are addressing public health matters, and then they gradually are transiting into youth-focused organizations when they also leave the age brackets. There are also training preferences in the global north, despite increase in the number of local institutions as well, offering programs in public health. So you have people going outside of the continent to actually study for various degrees in public health. Job creation is also still a major priority for several interventions on the continent. So there's a clear nexus between entrepreneurship, employability, and public health concerns as well. The major entry into the public health space is actually through volunteering and interning, and mental health is gradually also replacing as what is gradually becoming what sexual and reproductive health is. So which means that there is more and more attention to mental health matters. Funding focusing on youth-led organization is also emerging to insist and say that this fund is only available for organizations that are led by young people. Mobilization of funds is also still a concern as well. As I conclude on this, health inequalities is also still real, which means that very little population of young people actually have health insurance. And if I ask in the room, if you have a health insurance and you're a young person, can I see your hands up? All right, so just a little, at least relatively compared to the number of persons we have in the room. Alcohol and substance abuse is also getting into the space as a very clear public health issue. Health disease health education is also still low. Information about issues like cancer, like diabetes, various lifestyles that could actually predispose young people to poor health condition. Motor vehicle injuries are also still a major concern, the quality of driving. These are things that we are still not seeing a lot of young people actually get into the space as well. And it's understandable. It's also about where exactly are the funds when it comes to public health. You don't want to start intervening in an area that basically does not have a lot of resource mobilization going on in that sector. Prescription drug overdose is also still a problem as well when it comes to training with young people on public health. Quite a number of examples are here, and I possibly will just skip over this because of time, just to say that these are what young people are doing on the continent. We have the iPod app by 5 teenagers in Kenya, trying to track issues of female genital mutilation. There's a sanitary towel for every girl child done by Hope Worldwide Kenya. We have the ultra-portable digital chest X-ray machines now being manned by quite a number of young people trying to test for TB, tuberculosis, and making sure that the response time is actually shortened. In Nigeria, we're having cases where organizations like Youth of Africa is looking at sexual and reproductive health and rights from the entrepreneurship perspective, giving them secondary education, giving them a second chance at education in terms of vocational skill, and a second chance at actually understanding SGBV issues as well. In South Africa, we're having Treasure Your Pleasure campaign, looking at issues of SRHR and finding ways to make people, young people especially, excitedly talk about reproductive health matters as well. There are quite a lot of podcasting on public health issues also going on. I also looked at the entry point to public health. Like I mentioned, if you look at that chart, majority of those that were surveyed in the course of this said that they got into the public health space through volunteering and through interning. Do you think young people are engaging appropriately with public health issues in your country and using COVID-19 and other public health priorities? Surprisingly, the answer we got here was majorly what? No. 50% of young people felt that they didn't think that they were actually engaging appropriately. My interest again here is what are the challenges and what are the prospects for us as we go on. There's a gradual climb in the number of private and public institutions now interested in having conversations and planning around youth development. This pre-conference is also an evidence in itself. Some of the biggest role youth have played in the continent in the context of public health include social media advocacy. So you have a lot of groups saying they want to put young people on the table and help them actually raise a lot of awareness in terms of social media. But the mismatch we found also is that while those young people actually have the social media skill, they do not necessarily also have the required public health skill to drive the conversation in the way that it should be driven. So this is a gap, this is a prospect that could actually be harnessed. With a growing interest in public health by young people on the continent, internship and fellowship space also has to grow to match this in the context of online learning opportunities. This is something that HR professionals as well, interested in public health, would also have to fashion out. A major gap in public health as a concern to use on the continent too is the very minimal awareness on how they need to actually grow the space of clinical veterinary medicine. They need to ensure the consumption of safe animal food is at its barest minimum. Very few individuals and organizations, youth-led organizations, actually even program around this. Food animal melting and public health is an opportunity that the population of youth on the continent can actually harness. Public health in agriculture is also minimal when you talk about spray service provision as well to ensure that people are actually healthy. People still go to farm settlements, putting on knapsacks and spraying without any PPE, any material put on to actually protect themselves. Predictably as well, the addiction to social media content and online material can be harnessed by the leadership of public health in Africa for the training of young people, putting content where young people actually go, and the use of audio materials or the visual materials can actually be harnessed also in this area. Aside from this as well, the market is also growing for several health products based on various needs. And I'll finally end this by saying that our new lifestyles, spending hours on our phone, listening to music at very high decibel, is also going to bring up new challenges of public health, which means that ear, nose, and throat specialists, ENT specialists, will also start thinking about, look, how do we control, hard of hearing, patients in young people because of the amount of time they spend listening to music. The eyes as well, the hours we actually spend on our screen as well, the eating habits as well. So these are new places, these are new components that would actually emerge in the coming days. But in all, we say very clearly, and I say very clearly, that the prospects are bright, the gaps are there. We just need to identify them very clearly and begin to get a growing population of young people to program around this. Thank you very much.
Thank you very much, Shola. A big round of applause for Shola. What is clear to me is that a public health sphere is an ocean full of opportunities to be filled by these young people in this room and beyond the continent. Let me reintroduce the discussants. Rima, the technical officer for Egypt Healthcare Authority. I'm told it's authority, not agency as you have it here. Please, what are the key takeaways? What are the key insights from this background paper?
Thank you so much. Hi, everybody. It's a very interesting paper. It's really good to start a draft to start the conversation about engaging youth in public health in Africa. I feel like training youth is very important, but also we need to think broadly about training, but also you need to really have a really good network for you to be able to get a proper job, because you mentioned in the study that was in the draft that most of people engaging in public health on voluntary basis. So we need to change the culture and the mindset of governments. And you said that 66% of the youth felt like they are not included in the discussions and in decision making in public health, while, like as we said, that the majority of the continent is youth. So I think that we need to change the mindset in the institutions like government, NGOs, and international agencies to provide these youth with proper, fair, and safe spaces where they can be empowered and can get proper public health job opportunities across the continent. This is one of the things that was needed to be addressed.
Thank you very much, Rima. I will pass on to you, Dr. Abdishakur. When you summarize your thoughts, would also like to know, why do you think it's important for young people to be, or for us to map out the youth engagement in public health in Africa?
Okay, Thank you. Thanks to my friend Lucy for his effort of writing this valuable piece of writing. So I think it is an amazing paper of, as I see for his presentation. So it captures that the key demographic age of the continent is the young population, which means that if we want to enhance public health participation among the population, we get our focus to the young population. Because young population is the key demographic age of our continent, so I think we can say it has a deep relevance with the content of youth engagement in public health, ranging from addressing a social community theory in respect of low participation of youth in the public health issues on the continent, and also for the advancement of technology, as it was one of the trends, core trends for affecting behavior in young population. So also I can, it puts an emphasis of that in our modern societies we need a people who especially say public health to the health systems in order to introduce public health innovations which can respond or can be lasting solutions to the huge challenges, public health challenges of the continent. When it comes to the changing youth changing engagement modalities, I can recall that he's just included that accessing for the electronic big data and also for online resources could contribute, could help engagement of the youth, as actually, and it is one of the outstanding opportunities that we have in this contemporary world. Social media focus could help also. It is one of the main tactics that we can utilize to be changing behavior, and also for sanitation programs could contribute some as well, and also sanitation programs could contribute some, and also for the accessing other programs, that is like internet resources and all others. And finally, I believe that it is time to focus on to review our primary school programs, curriculum, and also to transform into a friendly public health curriculum. That is the area that we can improve our changing behavior from the next generations. So thank you.
Thank you very much. You are scientists. You like to think like scientists. But I would like us to look at the social aspect of this. What is the future of work in public health? Shola?
Okay, so interesting question there. What's the future of work in public health? I think it's going to blend into the future of what work itself is. Of course, you won't talk about the future without talking about technology. We're seeing patterns where several young people now, when you post a job vacancy, the first question you hear is this on-site or off-site? How many of you love off-sites? You love it when it's work from home, right? So these are new dynamics that we need to start looking at, to say, look, what are those things that can be done? Are there going to be dimensions to say, look, we need to start categorizing public health into the kinds of roles that can be done from home and the ones that you actually would do from on site, and then train people differently. It means we also need to train people in terms of the work ethics of actually doing things from their own private space as well. What does that mean too? But I also think we're going to have a lot in terms of bold pronouncements. The president of France just yesterday pronounced and said that starting from January, young people in France will have access to free condoms, right? That's the kind of bold pronouncement, because look, the reality too is that in those spaces, so look at the several instances that happened during COVID-19. We had increase in cases of sexual and gender-based violence because people were spending more time at home. For those of us who actually would do some work around trying to end female genital mutilation, there were instances where we had girls being caught because of that. So again, it would also mean that for a woman, for example, who works in that kind of space and has to stay at home, what does all of this actually mean in terms of components of SGBV, of the SGBV component for those who actually work off-site? So we'll begin to have certain tweaks around this. Technology is going to play a major role as well. Again, we're talking about mutations, right? So we'll still need to go back to some of the things that actually worked in terms of COVID-19 prevention, and keep some of those information, keep some of those education style. A lot would actually also go on social media. Social media is going to play a big role since we have tools like Google Trends, analytics to actually help us understand, people's pattern. These days now, you can actually tell what the interest is. So for those who use, search engine optimization, you go online today and you try to buy a condom online. For the next 2 weeks, you're going to have condoms actually chasing you all over the internet because someone has programmed you to say, look, you've expressed interest in the condom. So we're going to have more of these. People will be able to sit down at home and express interest in quite a number of public health products as well. Thank you.
Thank you, Shola. Rim, do you have a take on this question also, thinking about the future of work in public health?
I think working in public health, the future is promising because we started the conversation, and being here in the youth pre-conference is an evidence that youth are included in the discussions, and this is how it starts. Like African CDC is empowering a lot of young people, young public health professionals, and so Africa is really working so hard to try to empower young people despite all the challenges, because we cannot just only see public health separately, but we really have to see all the intersecting factors that's really affecting the participation and working in public health. But we need to address them clearly, and we really need to admit that we have problems, but we are really working on these problems in order for us to build on it. Networking with all of people, especially young people from the continent, it's an amazing opportunity, because you see that really these people are really keen about their continent and their communities and their people. So I think it's very promising public health, working in public health for the future. Thank you so much.
Thank you. Dr. Abdishakur.
It's really interesting working in public health in the future, and also to be engaged to develop public health in the continent and across the global. So I think this is an interesting area, and I hope it will be fine, because when we engage more, when we coordinate better in terms of status and in terms of the youth as individuals, that will be helpful for the future public health in the continent.
Thank you. But also, how do we ensure inclusive participation? How do we ensure that young people on both sides, those who work for public health institutions and those who do not, how do governments, institutions ensure participatory inclusion in discussions and decision making? Rim, do you want to take this one?
So I might talk about my experience in Egypt. We started the Egypt Healthcare Authority. It belongs to the Egyptian government, and it's just a newborn authority. It's 3 years old, and it's working for achieving the universal health coverage in Egypt. The head of the authority is 37. years old, and so as a CEO. So, and following like most of the people in the authority are like younger healthcare professionals. So I think that now I can see that political will, it should really come from political will, that people in top political positions should really believe in youth, and that without youth you won't be able to achieve a sustainable, healthy change in the continent. So what I want to say is
participatory inclusion.
Yes, I'm sorry, I'm a bit sick. So yeah, so this is what I'm saying is participation is very important, and as I said from my experience in Egypt, people are really working so hard to include youth in the discussions and in decision making, and it's very important to see, as I said, political will is very important, because with political will and with people believing that youth have the voice to and have opinions to express. And to be participating in health policy development as one of the components of public health. Thank you so much.
Thank you very much. Shola?
Okay, so I would advocate for, mentoring as, a key part of this. I think that it has to be deliberate. We have to have, policy designs around this to say that no, public health policy should actually, happen there. No public health program should be implemented there without there being efforts to actually intentionally mentor young people, such that they can actually also take over some of those roles, get actively involved. But again, I possibly would also still ask that we have some measures to evaluate what has been done, what are the progresses being made in terms of introducing young people, what are those things that they want to do. So the way, it is now, it's in terms of what do people want to consume. So it's in terms of health promotion and information, for instance, where do people want to consume this information? So we can't take it and say, oh no, it has to be on social media. Certainly several young people in the urban centers are on social media, but there are still several young people also in the rural community that need to still see the information on the community board. Several young people in the rural community that needs to still listen to those content on radio as well. Does it need to go out as a radio jingle? Does it need to go out as a radio drama? Does it need to go out as a skit on radio, for instance? So, but I think actually, involving young people in the design would actually help ensure inclusiveness without also, forgetting the population of persons with special needs, without discriminating based on people's, sexual orientation preferences, without discriminating based on what, individuals actually, the location, their indigenous identity. So if it's inclusive in that sense, I think it will serve the purpose of, several and all young people as well.
Thank you very much. You spoke about how more than 50% of young people do not feel included enough already. What do we stand to lose if these young people are never included in the future? Dr. Abdishakur? What do we stand to lose if we do not include young people in decision making in public health? Already we have 50% or more who do not feel well included in the public health sphere.
Okay, if we didn't engage for the youth in an inclusive way, that will be left behind more than 50% of the youth. That will cause that continent will be behind in terms of public health and the other development sectors from the other continents. So it's better to have an effort and put focus on how to engage youth in an inclusive way, and that's why I put my recommendation that we need to review our curriculum, our primary school curriculum, and transform into a public health friendly curriculum which can contribute to changing the behavior of our young generations through across a generation. So it's better off to have a plans and innovations that better coordinate the youth and engage in a way that most of the young people could engage in public health and the development in the continent.
Thank you. Riem? what do we stand to lose? What do we stand to lose if young people are not included early enough in public health?
It's going to be a waste of resources, especially the human capital resource with the youth. They're going to feel like they are neglected. As governments, like if I'm speaking about the government, we're going to be deliver campaigns and services that does not help the community, so it's going to be waste also of financial capital. It's like public health is very broad, so it's really going to affect not only like if people are not included and they are not provided with proper services like SRH services. We're going to have a lot of social problems and economic problems, and so maybe some kind of political problems. So it's really nice to feel like you are heard and you are being empowered and your voices matter. And from the previous discussions, is like you really need to demand. I think that the takeaway is we really need to demand your voice. It's not an easy way. Still, the continent think that some of the senior healthcare professionals discriminate youth because of their age. So, and despite if they have a really good experience and passion about making differences in public health, so. We really need to start talk about this, and we really need to demand a space. And I feel like here it feels like it's a safe space for us to speak about this in order for us to make the change. Otherwise, it's going to be a lot of waste in like as I said, human capital and financial resources and all the problems that it comes with it. And we have enough challenges and we have enough problems. Thank you.
Thank you. Shola?
Okay, so from my own end, I think, very clearly one of the things that would happen is that they won't get the big picture. Use COVID-19 again as an example. Where I come from, there were young people who actually revolted against, asking people to sit back at home. There are young people today who tell you that, no, I don't like to use the face mask. They tell you different, reasons why they should not, because they were not part of that process. They can't see the big picture, as to why this actually has to happen. So I think that's what we're going to majorly lose out. We're going to lose out in terms of getting the buy-in of young people. We're going to lose out of their creativity. We're going to lose out of their, using their networks to actually, get the information across. We're going to lose out of several other things that could actually happen, even in terms of education. We pray that we don't have a repeat of what we currently have, what we had with COVID-19. So the economy was shut down. Those are the multiplier effects. Education was not happening. Again, where it wasn't happening, we didn't have the structures to quickly get people back in the classroom using digital means as well. So these are some of the, the big things that I think that potentially we stand to lose if we don't put young people into our involvement as we design all of this.
Thank you very much. We conclude. Any final thoughts, recommendations?
I think I will take a remark from your paper. Is public health is proactive, and we're still reacting till now. So I think with trying to be proactive, we need to include youth in the discussion and in decision making to make a sustainable change in public health and youth engagement in public health in the continent. Thank you so much.
Thank you very much, Niman. Dr. Abdishakur, any final thoughts as we conclude? Thank you.
Okay, so my final thought and recommendation would be that I think the youth pre-conference provides us a very clear opportunity to begin to